is Larissa Fabritz. I'm a professor in cardiovascular sciences at the University of Birmingham, UK. Atrial fibrillation is a common arrhythmia. One of the therapies available to patients with atrial fibrillation is ablation of the atrial fibrillation and restoration of sinus rhythm. But a lot of patients suffer from recurrence of atrial fibrillation. In our study, we found that the concentration of the transcription factor, PTX2, in isolated cardiomyocyte nuclei of left atrial of patients with atrial fibrillation predicted the risk of recurrence after atrial fibrillation ablation.
Hi, I'm Dr. Jasmeet Reyat, a postdoctoral research fellow in the Institute of Cardiovascular Sciences at the University of Birmingham.
To begin to investigate the role of PTX2 in atrial fibrillation recurrence, we decided to quantify PTX2 expression levels in either whole tissue or cardiomyocytes isolated from left atrial appendage tissue from atrial fibrillation patients undergoing thoracoscopic ablation. These results were combined with statistical modeling using clinical characteristics. In whole tissue analysis, PTX2 showed a varied expression pattern, which, when stratified into if patients had experienced atrial fibrillation recurrence within a year post-ablation, showed no difference. This was potentially due to a high degree of tissue heterogeneity in the left atrial appendage samples. Given that PTX2 is expressed in the nucleus, we decided to also check PTX2 expression in cardiomyocytes. Using the PCM1 isolation technique, we were able to show that PTX2 was mainly expressed in cardiomyocytes. In addition, patients with lower expression levels of PTX2 were more likely to experience early recurrences, which was further exemplified when the expression of PTX2 was split into quartiles. These data suggest that PTX2 expression levels negatively correlate with atrial fibrillation recurrence. Although PTX2 expression levels were able to predict AF recurrence, it can't be measured easily in patients. We next sought to find a PTX2 regulated cardiac specific biomarker implicated in atrial fibrillation recurrence, which could be detected easily. We decided to make use of a PTX2C deficient mouse model. This mouse model is deficient in the cardiac-specific isoform of PTX2. RNA-seq analysis of left atrial tissue identified bone morphogenetic protein 10 as a potential PTX2 regulated gene. The RNA-seq findings were validated by qPCR and Western blotting. In addition, BMP10 expression was only detected in cardiomyocytes from human left atrial appendage tissue. These data identify BMP10 as a PTX2 regulated gene. However, it remained to be shown if BMP10 expression was altered in patients who had experienced early atrial fibrillation recurrence.
Hello, I'm Dr. Winnie Chua. I'm a postdoctoral research fellow at the Institute of Cardiovascular Sciences, University of Birmingham. You have heard from my colleagues about how the transcription factor PTX2 regulates bone morphogenetic protein 10 or BMP10 and that low PTX2 levels are associated with high BMP10. This is important because BMP10 is cardiac specific and is a secreted protein, making it easier to measure clinically than PTX2. To confirm if elevated BMP10 levels could predict recurrent AF episodes, we quantified BMP10 from plasma of 359 patients with AF who underwent catheter ablation using a high-throughput pre-commercial assay. As hypothesized, we saw significantly elevated levels of BMP10 in patients who experienced recurrence episodes. Now, there are many established clinical predictors of recurrent AF. To see how BMP10 performs amongst these predictors, we modeled BMP10 with clinical predictors of recurrent AF identified from a meta-analysis. We found that the best predictors of recurrent AF were large atrial size, a non-paroxysmal form of AF, and high levels of BMP10. BMP10 was also the best plasma biomarker compared to 11 other common cardiovascular biomarkers for predicting recurrent AF. When stratified into BMP10 quartiles, the highest quartile had the largest proportion of patients with recurrent AF and the highest recurrence rates over 2 years of follow-up. Taken together, we conclude that BMP10, a PITX2 regulated biomarker, is a strong predictor of recurrent AF after ablation.
We think that the results of our studies will help inform risk stratification for rhythm therapy in patients with atrial fibrillation.